Hello, welcome to the Ektos demo video where we are going to show now, after we've updated the declaration and the nurse has approved the declaration, how we can move to the update of appointment as the next step. So now it will show in the nurse tab in the queued and in progress status. Queued means that it is still with nurse and it's not yet ready for the doctor. So what we do is we click on update appointment screen and we see that the declaration and appointment nurse has been updated, and if needed, the user can change it to a different nurse. Now you add the height, weight, and other information. So now the nurse is updating the examination details for the physical examination of the patient. As you can see here, the vitals like height, weight, BMI, temperature, pulse, etc., the blood pressure. These are mandatory, not mandatory fields, but if needed, they can be made mandatory as per the requirements of the hospital. Then a general assessment on the lifestyle, alcohol consumption, social and smoking status, etc., will be captured. And if any comments for the mental status, general well-being can also be added. Now we move to the next tab, which is the systemic examination tab. So we add the seismic examination details for the CNS, CVS, and the respiratory values that can be added. They can add the different local examination details, like anything they find on the abdominal, chest, or respiratory region that needs to be informed to the doctor. Now, when we submit to the doctor, this will no longer be available for update by the nurse. So I'll just submit now. You will see that it goes away from the nurses tab and it goes to the doctor tab now in the status ready or now. Ready is when the doctor is ready to see the appointment. At that time, they will mark icon. Until they mark this, they won't be able to enter. So they have to mark a icon called uptime. So as they click on that icon, it updates the visit time, which means you can identify how long did it take for the patient to go and visit the doctor. When I click on update appointment now, I will see the information updated by the nurse and any comments from the nurse side for the seismic examination, local examination, and general physical attribute. They can update the diagnosis information with whatever information they understand needs to be added in the diagnosis section. And so in the investigation tab, this is a SNOMED specific code that they will be entering for cough, for examination of fever, etc. From the drop down, they can select different other options if as suitable. These are again SNOMED based integration. So for the fever measurements, examination, etc., you will have the values here. Here, the doctor can select the list of medicines. These medicines come from our existing database, which is also a SNOMED server built to incorporate all existing medicines in the as approved by the NHA. So the doctor can prescribe the medicine quantity and how many days, um, what will be the cold and fever both, how often it has to be taken before breakfast, lunch, or dinner, and then any lab test for complete body count or fasting blood sugar, you can recommend and update the appointment accordingly. So when we click on next, this prescription will be generated. If any doctor needs to be referred, you can select referred and refer to existing doctor within the same hospital. Create a referral appointment for them. Any notes that needs to be added, and that's all. This completes the appointment and it saves it with the patient. And you will see the whole appointment summary here, which can be printed and downloaded, or and the prescriptions separately can also be printed. So this completes the appointment now, and it moves it to the old appointment section, as you can see here. Um, and it gets all the prescription appointment details. And on the patient tab, when I visit, I will also have a prescription that's automatically generated, as you can see here. Now, these templates you can update, and these templates can be updated from the settings and prescription module. So when you go into the patient tab, so even in the patient tab, we have all the prescriptions and appointments that is generated. as seen here on the prescription details tab. And you can configure this to match your particular requirements for prescription. Appointment section as well. We will have all the appointments recorded for that patient in the appointments tab. In the appointment tab, you will see all the patient's appointment completed, and you can look at the appointment and any notes that comes up. And even in the notes section, you will see in the view vital details, any information that we updated gets reflected here at each time the patient gets visited. And you can see their blood pressure or other information updated accordingly, as you see here. So that's how from the first step of the patient coming in, you will now have the appointments completed and it moves to the old appointment section, which you can see here.
With this, it completes appointment status to completed, shows in the old appointment section, and now it completes the entire OPD flow from the patient coming in to the appointment and prescription being generated. If you would like to see the other videos, please refer to the playlist on our YouTube channel. Thank you so much for watching.